Thank you, Governor, for those updates. I also want to thank the reporters who are working today to help keep people informed. As the Governor has shared, we continue to see cases. We have 12 additional cases, which brings our total case count to 66. 8 of these people are males, and 4 of them are females. They range in age from someone in their 20s to someone in their 70s. The travel we're looking at among this group of people is all domestic to Boston and New York. Of these 12 people, 3 are hospitalized. It's important to be able to relay that as of now, in conversations with hospital CEOs, there is capacity in our hospitals to care for cases. What we want to do is to maintain that capacity, which makes it so that people who are ill and who can recover at home should do so. It's also why we have been saying through this time that if you haven't received a flu shot, you should do so. A flu shot helps make it so that we have the capacity in the hospital systems that we have, because even if you were to get the flu, you are less likely to be hospitalized for it. I also wanted to make people aware that the Massachusetts Department of Public Health announced yesterday, sadly, that a man in his 80s passed away from COVID-19. We have no indication that this case was connected to Rhode Island. I only bring this up here because while we are working night and day in Rhode Island to limit the spread of COVID-19, we want to be 100% candid and continue to be so, and let you know that at some point Rhode Island could see a COVID-19 fatality. I'm not referring to any case in particular. We are continuing to evaluate and don't currently have any fatalities right now connected to COVID-19, but this is continuing to evolve. And I want to help people understand the reality of what we are dealing with as a country right now. So far in the United States, unfortunately, more than 200 people have died as a result of COVID-19. Again, this helps us reiterate everything that the Governor just said. Following the directions that we are laying out for you does make a difference. We are doing everything we can with your help to protect all Rhode Islanders, including our more vulnerable populations. So please, if you are tempted to go to an event that has 10 or more people or to play in a game that has 10 or more people, refrain from doing so. It does make a difference. This is a very serious health issue we are dealing with, and we're being very realistic in dealing with it. The recommendations we are making are critical. I also want to report that we are continuing to be contacted by people who are looking to donate personal protective equipment and laboratory supplies. We are extremely grateful for everyone's generosity. It is a true demonstration of Rhode Islanders coming together. If I could make one more ask of people who are able to donate, please use the online form we have developed. Even if you have been willing to donate and have had communications with us, put that information into the form so we can continue to log it. The website for that form is bit.ly/COVID-19-M as in Mary, S as in star, D as in David. bit.ly/COVID-19-MSD. Using that form is the way to ensure that your offer will be received and to ensure that we will follow up with you as soon as possible and could put what you are offering to good use. In addition to people who are able to donate, a second audience I want to address this afternoon is our smokers. We are still learning about COVID-19 as a disease. However, we do know that when someone's lungs are exposed to the flu or other infections, the adverse effects are much more significant for people who smoke or vape. Because it attacks lungs, COVID-19 could be an especially serious threat to people who are currently smoking tobacco or marijuana or those who vape. I know that quitting is hard, but I want to make people aware of this increased risk, for one, and then also remind people that there are free quitting resources available. Call 1-800-QUIT-NOW. Other populations that are more vulnerable to the complications of COVID-19 are our older adults and people with underlying medical conditions. It is so important for older adults, people with underlying medical conditions, and everyone to be limiting contact with others. We have said that that is how the virus spreads. If you can stay at home the way we are asking everyone to do, only going out for essential needs as very brief trips and returning home, that can significantly limit the virus from being passed from one person to another in public. When we don't feel well, it's important to know that it's necessary to call before going into a doctor's office if you feel that symptoms are severe enough. We know that we're used to going to the doctor to get a rapid flu test or to just be evaluated. COVID-19 in this situation is working differently. If you have symptoms like a fever or a cough, stay home and isolate. There are ways to be able to do that even if you have other people in your home at this time. Keeping a distance from those other people in your household, using good cough etiquette, washing your hands frequently. In the meanwhile, we are working very hard with the governor's support to get supplies so that we can expand testing and ramp up to the number that the governor described and even more. We are close to it, but we will let providers know when that is available. Until then, we want people to continue to please follow these recommendations. Being able to stay home and stay safe and recover safely there is critical. Before going to any healthcare facility, it's important that you call first and really reserve it for those situations where you feel it's necessary. We want to make sure you have all the information that you need in knowing that the treatment is the same: rest and fluids and staying safe as you recover at home. If you think medical care is needed, as I have been mentioning, it's important to call your doctor, not to just go see them. We need people to do this to really help prevent the spread of COVID-19. And most importantly, it's critical for all of us to protect the healthcare workers who are on the front lines, ready to care for people who really need it.